Inflammation is truly the root of so many problems that we don't think of as inflammation related. As a matter of fact, the list is so extensive, I made a list to make sure I don't forget it. From respiratory problems, recurrent bronchitis or croup or RSV infections, big tonsils, big adenoids, recurrent sinus infections, anxiety, chronic fatigue, ADHD, migraines, nearsightedness, eye inflammation, recurrent pink eye, tear duct inflammation and closure in infancy, eczema, hives, psoriasis, hair loss, GI problems, you name it, from irritable bowel syndrome to Crohn's disease to ulcerative colitis to lactose intolerance to constipation. Overactive bladder, having to pee, babies who are prone to, or children, younger children who are prone to recurrent urinary tract infections, or have to go pee all the time because their bladder is so overactive. Irritations of the vaginal or penile area in younger kids is very commonly associated with propensity to inflame. And many infectious diseases. One of the things I hear a lot is, my child gets strep throat all the time. They don't get strep throat all the time. They get a sore throat more than others would when they get a sore throat. Their propensity to get tested is more than others. And the discovery of that strep bug is more common than others. Well, that's a complicated set of things to go through, and that's why nobody talks about it. There's so many other people who have strep in their throat, as we have hundreds of other bacteria that are completely clueless to it and don't have to do anything about it. Who discovers that strep but the one who gets tested more? So it is with mono, for example, mononucleosis, infectious mono. Some people with higher sensitivity show the symptoms of mono more, the tiredness, the fatigue, the bigger tonsils, the belly pain. So they're more apt to get tested for mono, and they get diagnosed with mono more than others. They don't catch the monovirus more than others. They get diagnosed with it more than others. So it is with flu, so it is with COVID, and so many other infectious etiologies that we have a test for. Most people don't even get tested. They're completely clueless to it. Those with higher inflammation, they manifest the symptoms differently.